Hello, welcome back to the channel where I make videos about nursing school, I guess. I've never said that before. I don't know why I felt the need to say that. I kind of always take a long accidental break in between videos. I think I just get caught up in life, and then also I'm very in my head about how to make the perfect video, which none of them are anyway, so I need to just get over it. But we just started what would be my final semester yesterday, and in the last few days I've met some of the new cohort, and if you're watching, a lot of you have come up to me to say hi and let me know that my videos are helpful, which so sweet, so fun. I'm very grateful for you coming up to say hi, and I think I just have like a newfound purpose to continue making videos because it was like, you know, a real life, almost like tangible evidence that the video is being used for its intended purpose. I honestly can't remember the last thing that I spoke about in terms of classes on here, which I probably should have gone back to check. But I'm pretty sure I touched on all the spring classes, all the fall classes, or rather all the fall classes, all the spring classes, except for the 5 clinical rotations. So I'm going to go out on a limb and talk about those didactic portions of those classes. In an upcoming video, I will talk about the clinical experience as a whole, all the way through integration, which other schools call their capstone. Starting with psych, which was actually my final rotation. This course expands upon foundational knowledge of biophysical health problems to provide a comprehensive understanding of nursing care of the person experiencing acute and chronic mental health disorders. It integrates biopsychosocial sciences, epidemiology. Why do I feel like I already did this? And nursing sciences to deliver patient-centered, evidence-based care across the mental health, mental illness continuum across the lifespan. Students will develop critical thinking, clinical reasoning, and interprofessional collaboration skills to ensure safe, high-quality, and equitable care within the context of the person, family, and community. MedSurg 1. The course expands upon foundational knowledge of biophysical health problems to provide a comprehensive understanding of medical surgical nursing care for adults. The course integrates biopsychosocial sciences, epidemiology, and neurosciences to deliver patient-centered, evidence-based care across the health-illness continuum. Students will develop critical thinking, clinical reasoning, and interprofessional collaboration skills to ensure safe, high-quality, and equitable care within the context of the person, family, and community. Okay, wait, they all kind of say the same thing. MedSurg 2, comprehensive understanding of medical surgical nursing care for adults. Yeah, kind of says the same thing. Then we have PEDS, comprehensive understanding of nursing care of the child, particular attention to growth and development of the well child and family. And OB is comprehensive understanding of nursing practice and sexual and reproductive health care. Deliver patient-centered, evidence-based care during family planning, the process of pregnancy and birth, and in the care of the newborn. Okay, well, that was a lot simpler than I thought. It kind of all says the same thing, which I guess makes sense. I guess I can talk a little bit about my experience in each of the classes if I haven't done so already. God, I don't know if I did. Oof, this is a tricky one to talk about, but I'm gonna be honest. I was really looking forward to this class because I'm someone who's been interested in psych for a long time. I thought that that's what I would do in undergrad and what I would do in life. I thought I would be some sort of clinical psychologist or therapist or something in the psychology world. And it still very much piques my interest, but it's definitely not my calling in life. However, psychology is, or like the psychological principles are very intertwined in everyday life. And as a healthcare provider, future healthcare provider, it is something to really heavily consider in patient care. And I had never looked at psychology or mental illness and its treatment through a nursing perspective. So I was very interested to know what that would entail. Unfortunately, I found the class to have a very narrow view of many disorders, and I would say all of the disorders that we learned about, a lot of which I didn't know details of prior to this class, were framed only through very stereotypical presentations of that disorder. So it's not to say that stereotypical presentations of bipolar disorder, OCD, etc., don't exist, and that those manifestations aren't real for many people. And I don't want to discount that at all, because that's very harmful. However, I firmly believe that there are many, many, many people who fly under the radar and don't get appropriate treatment just across their life, but especially in a medical setting where things are already scary and not always the best, and a lot of people lack confidence in the medical system for very valid reasons. And I think perpetuating these only stereotypical presentations only creates more of that harm that further alienates people from seeking care. That being said, there were many things that I did learn about, which I thought were helpful. And we learned a lot about the medical management, particularly regarding medications. So that was very interesting. And being in the hospital with patients with these different disorders that we were talking about, and being able to look through their medication lists and their charts about the symptoms and side effects and all the things, was really, really fascinating. At the same time, the clinical experience to me did feel a little extra invasive. I'll talk a little bit more about the one experience that really was hard for me to be present for in the upcoming video about my clinical experience as a whole, because I don't want to make this too long about that. But yeah, just a lot of mixed feelings, and I really, really do wish that the class had a little bit more of a broader view, and talked a little bit more about lived experiences of people who experience these different disorders on different levels, right? Because a lot of these things are spectrums, and not everybody experiences the most severe form of X disorder all the time. And so I think that would have been really key to include in a class like that. But what do I know? In terms of exams for this class, gosh, I don't even really know how to go about talking about this. They were pretty awful exams, if I can be brutally honest. I didn't feel like our lectures or the slides prepared us appropriately for a lot of the questions on those exams. There were, of course, some questions that were like easy if you studied the material. There were other questions that were fair, but then there were those questions that was like, what, we never ever learned this. A lot of the lectures will kind of give you a general idea of something, and then the exam question will be a very specific thing that was never mentioned in lecture, or that's not anywhere in the slides, but you're somehow supposed to link that to the very general thing that was mentioned. There also wasn't very much explanation of questions that you might have gotten wrong. You're allowed to review your exam, but if you ask why was it this and not the answer I chose, the response is kind of like, that's just how it is. Moving on to MedSurg 1 and 2, fantastic classes. I feel like I learned so much in both of those classes. There's probably so much that I have since forgotten, which is a shame, but I'm happy that I'll always have my notes to look back on and the slides to just kind of jog my memory on things. It truly is so fascinating, all the things that we discussed and all the things that we learned, and just very enjoyable classes. Being in the hospital for those 2 rotations was also very, I just feel like I learned a lot. And a big part of me actually doesn't mind med-surg nursing. A lot of people really hate it and don't want to do it at all. And that's fine. It's good to know that you don't want to do that. For me, if it weren't for the fact that it's very physically demanding, it's very physically heavy on the body, and you have to have really good, what is it called? It's on the tip of my tongue. Body mechanics, so as to not injure yourself. That's the challenging part for me, because I already injured my spine a few years ago, and I don't want to ever put myself in a situation where that could happen again. And I feel like working with adults in a med-surg capacity is tricky in that regard. It's very physically demanding, but you learn so much. You kind of have to learn how to prioritize, which is what med-surg really is all about. So it's a really good learning experience, and I can definitely see why in the past basically all nurses had to go through med-surg before being able to go into any specialty. Exams for med-surg 1 were my favorite exams I've taken in the entire program. So well thought out, so well prepared, and so closely mirroring exactly what we learned in class. I would love to have a copy of that exam just to refer back to it and quiz myself through the years, because I don't know, something about those exams was just so fun, because it really made you think. And when you arrive at the answer, you feel really accomplished and you feel really smart, and you feel like, oh my God, I have learned so much. So I especially felt that way about the final exam, because all of her exams are what she calls lightly cumulative. So it's not that anything from the previous exams is specifically in the following exams. It's just building on concepts that you learn from week 1 up until week 5. And then she starts kind of incorporating all the pieces together by the 3rd exam, which just made it so fun. The style of class is a flipped classroom, but I think she does a fantastic job at making worthwhile your time. You have to show up to class having watched those lectures, because in class, she doesn't lecture. She'll answer questions, she'll go over things, but most of it is in-class group activities, and also solo activities that test your understanding of the material. So if you show up to class not having watched lecture, you're kind of really screwing yourself over. And it feels stressful at first, and it feels really intimidating. But as I said, it's like a gratifying experience to feel like, wow, I was able to answer that. I did that. I put, all those things together and came up with an answer, came up with the right answer, or came up with mostly the right answer. And these are the things that I need to review. So I feel like it really prepares you well for her exams. It opens you up to good discussion in class. Just 10 out of 10. MedSurg 1, I think that's my favorite class the whole semester, the whole program. MedSurg 2 was overwhelming. There was so much information, and we didn't really fully know how to study for exams. Thankfully, we had a faculty advisor serving as like a TA / other teacher. She would do some of our classes. The main professor would do some of our other classes, both extremely smart, so knowledgeable. And she really helped kind of break down all the information so that we knew kind of what to focus on when it came to exams. But I just feel like we got so much from that class. We learned so much. I honestly don't remember what the exams were like. I don't know why I'm blanking on those exams, but I feel like they were fine. Peds was also really fascinating. I feel like I learned a lot in that class as well. I don't think I have any real grievances, but it wasn't like my top favorite class in terms of, I don't know, maybe structure. I don't know how to explain it. Good material, good content, I think, and I learned a lot. The exams in that class, I will say, are very tricky. A lot of very random specific details were like the main focus on a few of the exams. Well, there's only 3 exams, but on a few of the questions on all of the exams. It wasn't as broad strokes as I thought it would be, so that kind of surprised me a little bit, but I mean, we learned about it, so it was fair game. Okay, moving on to OB. I think this is the last rotation to talk about, and I think in the future I want to do midwifery, so it was kind of my bread and butter. But something about it just felt a little bit off to me. Like I was really hoping for a magical journey in the class, and it kind of felt a little like it fell a little bit short of that expectation. Those exams were like fine for the most part. Some people find them really easy. I didn't find it particularly to be like the easiest exams I've ever taken, but they were fine. They were like pretty straightforward. My rotation for this class was just, I don't know, it was just so lovely. I love it. Each of the classes has one like project component to it. Not anything super involved. You'll have time in class, from what I remember, like the professors will kind of allot some time so that you don't have to worry about doing it once you're home, meeting up with a group and whatever. I don't remember feeling as overwhelmed, but because you're taking these condensed 5-week classes in the stretch of a long semester where you have 2 other classes that span the entire 15 weeks, you really feel that difference. And I think I kind of spoke about that in my previous video, but the other classes feel like they're just going on forever and they're going like kind of at a normal pace. And then the 5x5s are just boom, 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 boom. And like you're just breezing through. So keeping up the cadence on both ends, it kind of feels a little dissonant and a little bit funny to navigate. But I feel like this video is like an hour long. So I'm going to try to chop it down because I'm such a yapper. And then be on the lookout for the next video. Hopefully not 5 million weeks after this one goes up, about clinicals. If you have any questions that you would like answered about clinicals, feel free to message, comment, whatever your questions, and I hope to be able to answer them by the time I record the next one. Yeah, okay. Take care. Good luck to all the new students on your semester and beyond, but let's just take it one step at a time. Let's have a great semester. You got this. You can do it. Bye.